But first, in our health headlines this morning, what to know about early onset colorectal cancer. Also, does a woman's ovulation impact the moods of people around them? And what to know about a previously rare condition that's now surging due to legalized marijuana. Joining us this morning, Dr. F. Perry Wilson, Associate Professor at Yale School of Medicine, Yale Medicine physician, and the author of How Medicine Works and When It Doesn't. Doctor, great seeing you again. Let's start out with this. The rate of colorectal cancer among people between the ages of 45 and 49 has really dramatically increased in recent years. What should we know about colorectal cancer screening at this point?
Yeah, it has. The rate in people in my age group, actually, 45 to 50, has gone up by about 2% per year since the early 90s, and then 12% per year over the past few years. Now, that last very rapid bump is probably because screening guidelines have recently changed to recommend screening for people from age 45 and up. It used to be 50 and up. Data shows that only about 20 to 25% of people in that age group are getting their routine colon cancer screening. So I want to remind people that because of the Affordable Care Act, colon cancer screening needs to be covered without a copay by your insurance company. So if you're in that age group, you can do it. Also, if any first-degree relative had colon cancer, you're eligible for screening 10 years prior to the age they were when they were diagnosed. And that, for some people, might even be younger than 45.
Okay, doctor, this is kind of a touchy subject right here. Unknowingly, humans still respond to smell cues from other humans, and a detailed study has been done about the effects of a woman's body odor on those around her. What can you tell us about this study?
Yeah, I like to bring you the most important medical information, but I couldn't resist. This was too interesting. This was a study that had women wear a patch under their armpits for a day, and men would then smell them and rate their mood and feelings on some standardized surveys. They actually found that during ovulation, men rated those smells as more pleasant. They felt calmer and less hostile. But what was cool about this study is the scientists actually isolated the compounds in the sweat that had those smells. And the two big ones were something called geranyl acetone, which has sort of a grassy, lemony scent, and tetradecanoic acid, which is present in breast milk and has sort of a waxy, creamy scent. So I suppose the take home here is, if you're looking for a new perfume to soothe the savage beast, yes, those are some of the scent notes you might be looking for as a woman.
All right. Doctors, you guys study everything. I guess that as well. All right. A formerly rare condition called cannabis hyperemesis syndrome has exploded about 300-fold in the less than 20 years, stemming from legalized marijuana usage. What exactly is this condition? Why is it in the news all of a sudden?
Yeah, it really has gone up dramatically. Cannabis hyperemesis syndrome means excessive vomiting. That's the medical term. And so these are people who are chronic cannabis users, marijuana users, who, find themselves getting very nauseated, vomiting, sometimes multiple times a day or a few times a week. A weird little quirk of this is it seems to be relieved by taking very hot showers. So if this is sounding familiar to a viewer and you feel like I only feel better in a hot shower, that's somewhat typical of this syndrome. It's certainly on the rise because the access to cannabis has increased so dramatically. But it's also on the rise in part because doctors are much more willing to diagnose this now, knowing that it's legal in many states, including Connecticut, as opposed to in the past when a diagnosis might out someone as a user of cannabis, which could have some professional complications. So I think it's a mix of both better diagnosis, but also increased incidence.
All right, Dr. Wilson, fair to say we hit on a variety of topics this morning.
Always like to bring you the interesting ones. Yeah.
We appreciate you. See you later.